For women, when it comes to hair loss, the most common things that I see in my practice are women who are experiencing hair loss due to hormonal issues, so things like hypothyroidism, women who are experiencing it due to nutritional deficiencies like iron, zinc, copper, and also women who are experiencing it due to stress, and then of course the people who are dealing with it post-COVID. Those are the top ones that I see in my office. I love doing injections for hair restoration. You can also do at-home things like laser caps, which can be pretty effective, especially with helping the mitochondrial dysfunction, really kind of juicing up those cells with the red light. But what we do in clinical practice is injections for that. Number one thing being PRP, and sometimes adding exosomes to that PRP as well if we just need some additional strength. Normally, when it comes to hair loss, we recommend a series of 3 spaced about 4 to 6 weeks apart, or each session 4 to 6 weeks apart, simply because we want to be able to get the follicles in their different growth cycles. Sometimes I'll do just plain PRP, sometimes I'll do PRP with exosomes. It really depends on the individual's needs. The best way that I can describe exosomes is that they're kind of stem cell secretions. Or like if you were to take stem cells and run them through a juicer, exosomes are what might pop out. It's how the stem cells carry their message or send their message. Another way that I can describe it is if you're thinking about healing like a construction site, the exosomes are going to be more like the workers who are just there to carry out a specific task and then they're done for the day. The stem cells are going to act more like the foreman. They have the whole plan, they know the whole job, they know all the things that can be done, they can bring in more workers, they can hire more things, they can get more supplies, and they just run the show. Well, when we have something like hair loss or really any other thing, when we're taking in the exosomes, we're bringing them in to do a job and to do it well and to do it fast, it can really just potentize whatever procedure you're doing very strongly. Hair restoration, you're in the office for about a total of an hour. A lot of that time is just spent processing whatever sample of the PRP that we take from you. We spend a good amount of time putting in some numbing as well so that it's completely comfortable. And of course the injections do take some time. Depending on the individual, sometimes we have to do anywhere from 40 to 80 or even 100 injections over the scalp. So the way that I like to map mine out is that I'm basically doing a 1 centimeter square grid so that we're getting a really nice spread of that. And when we're injecting at about 0.1 cc's or 0.1 milliliters at each injection site, you're getting that nice little spread throughout that space. So we are really covering the entire area. We have ways to numb the area so that you pretty much don't feel anything besides a possible slight needle pinch, and it gets to be really, really comfortable. Some people opt for that and some people don't. I haven't had a patient that didn't get some results. It's a matter of how much growth did we get you, or was it what you were looking for? I've had patients where they get really great growth after a couple sessions and then they're good and they're all set. Some patients require a lot more to get the goals than what they're looking for. Patients who wouldn't be good candidates would be anyone who has current cancer. And ideally, our hair loss patients in general, you still have to have a live follicle there. So if there is no live follicle, that's not going to be a good candidate for it. You'd have to do the transplant.